So, first what you're gonna do, I don't know why, I feel like I usually start at the interproximal. So you just take the cord, you can feel with this instrument the margin, and you just want that cord to go right in between the two, okay? You shouldn't have to push that hard, to be quite honest. And 9 times out of 10 it'll slide in. Every once in a while you'll have a patient who has a really tight tissue and it just won't go. That you'll probably have to use a little more force for. But again, it's usually pretty easy. You can see this is just kind of sliding right in, and that's what you want it to look like. You don't need to bury the first one, but you want it where you can tell it's down in there, okay? It's not sitting like, sometimes I'll come in and it'll be sitting kind of like that. Like that's not a packed cord, okay? So it needs to be down. You can see how it just kind of tucks in. Go around. You just follow it. Good. So this distal is going to be a little trickier because that margin goes down deeper, so that tissue is going to be tighter. But look, it's still going in nicely. So what we don't want to do, like the worst is when we come in and it's all, the tissue's all beat up, and I can tell there was just a lot of struggle and a lot of poking in different ways, because that's going to make our impression much less pretty. And if we don't get a good impression, as you know, we probably aren't going to get a good crown margin, or crown back. Oops. So I just keep tucking. Okay. And then, same thing, I'm going to loop it. So put the shorter end in first, and then I just double wrap that taller end. You can trim it if you want, but I do want 2 cords around this one. Well, pretty much every prep, I would like 2 cords, because that's what's going to get us our either beautiful impression or a beautiful scan. So, voila, there is cord 1, and you can see that's pretty much exactly how we want it. Tucked pretty well. In some spots you can't really see it, which is great. Back over. Good. Okay, now we'll grab our second cord. Okay, that's going to be our thicker one. So that one you're not going to want, it doesn't need to bury, okay? It's going to kind of sit more on top. So that cord pushes down. This cord, if you think about it, pushes laterally. So it's going to push the gums out to the side a little bit. So, same thing. I just kind of usually start right at that line angle. I don't really know why. And you can see, you'll end up seeing a little bit more of this cord, but it still needs to go in, okay? But again, as atraumatic as possible. Kind of following, going around. Again, you'll see it stick out a little bit more, and that's okay, because we don't want to bury this one. If you're burying 2, that person's got some attachment problems. Again, I already know that this distal is going to be a little bit tighter. I might need to use a little more muscle. But still, I'm not having to push too hard. It's going in nicely. So I'll try to tuck this little tail, but I've already double wrapped that. So that one's actually, this part right here is triple, if you think about it. So I'm not going to really worry about that. Okay, there's our beautiful cord pack. Thank you.